Okay, I think we'll get started. Good afternoon, everyone, and welcome to today's webinar. So our topic today is foot care, and we're going to be discussing PPE amidst COVID-19, as well as having a brief overview of the National Foot Care Competencies published by the Canadian Association of Foot Care Nurses. My name's Kathy Arsenault, and I'm the practice consultant for the Association of New Brunswick Licensed Practical Nurses, and I'm going to be moderating the webinar for today. And before I introduce our guest speaker, I just want to take a few moments to explain the webinar format for today. So we wish to advise you that the webinar is being recorded and it will be uploaded to our website. So please feel free to share with any of your colleagues who weren't able to join us today. Your microphones are going to remain muted throughout the presentation due to the high volume of participants. If you're having any difficulty hearing the presentation, please just try adjusting your audio settings. And you can find this setting when you hover your mouse over the left-hand corner of your screen. At the end of the presentation, there's going to be a question and answer period, and we ask that you type your questions into the Q&A box, which is located at the bottom of your screen. You may type these questions in anytime throughout the presentation, and questions will be answered at the end of the presentation. If we're unable to get to your question today due to some time constraints, please email us after the presentation and we'll get back to you individually. And foot care has certainly been a really hot topic for us during COVID-19, and I did want to just take a moment to thank you all for being so mindful and diligent in regards to resuming your operations. I know it's been a quite challenging time trying to keep up on the public health recommendations that we know are changing all the time. So I'd now like to introduce you to our guest speaker today, Audrey Wall, who's the president of the Canadian Association of Foot Care Nurses. Audrey's been an RN for more than 25 years, and she's practiced in a number of capacities, including hospital-based nursing, long-term care, teaching in the nursing program at Brock University, and within a family health team as a certified respiratory educator and teach certified smoking cessation specialist, as well as a foot care nurse. In 2018, Audrey opened her own nursing foot care clinic, which was the first of its kind in Niagara, Ontario. Audrey believes in the value of a national association for nursing foot care and has been working with the Canadian Association of Foot Care Nurses over the past 5 years in a number of capacities, as well as participating in the group tasked with developing the national competencies for advanced nursing foot care in Canada. As the current president of CAFCN, Audrey is committed to promoting best practices and excellence in nursing foot care and is dedicated to empowering, equipping, and educating foot care and nurses everywhere. Audrey has a passion for excellence in nursing. She is an RN in good standing with the College of Nurses of Ontario. She's a member of the Canadian Nurses Association, the Registered Nurses Association of Ontario, and IPAC Canada. As part of her role with CAFCN, Audrey is a member of and represents CAFCN on the CSA Technical Committee for Medical Device Reprocessing and the Multidisciplinary Diabetic Foot Task Force. Audrey lives with her family in the Niagara region of Southern Ontario in the heart of wine country, and in her spare time, she loves to make pottery and play one of her ukuleles. So, without further ado, I will pass the presentation over to Audrey, and welcome, Audrey.
Thank you, Kathy, and thank you for having me. Thank you to Joanne Graham and to Kathy for arranging this. It is such a pleasure for me to connect with you all, and I know that, like Kathy said, foot care has been a hot topic during COVID, and so there's a lot for us to talk about. Excuse me, I have allergies, and I did take some allergy medicine, but I have a bit of a tickle in my throat, so I do have some water, so I do apologize if I have to take a drink every now and then. So today we are going to talk about PPEs and practice in New Brunswick during the current COVID-19 pandemic. I'm going to introduce CAFCN to you a little bit, and we're going to talk about the national competencies for advanced nursing foot care in Canada. Okay, somehow now I have, okay. So PPEs in New Brunswick during COVID-19. So what has come really into clarity for me is that as foot care nurses, we are dealing with two very separate issues. And Kathy, you know what? Sorry, before I continue, there is no way I've been able to bring up the chat box. So if there's a question, could you just please message me or let me know, because somehow my screen doesn't allow me to pull up any chat boxes.
Sure, it's okay.
Thank you. Okay, so we're gonna go, I don't know why that happened. So we have infection control for foot care. We have infection control for COVID. And I think that the very critical thing whenever you're doing your work is to start thinking critically about what you're doing, why you're using PPEs, what are they for? Okay, so if you are looking at a regular foot care visit before the time of COVID-19, what were your PPE requirements before then? Okay, now we're going to add the COVID-19 piece. And what our job is as nurses, always, no matter what kind of nursing we're doing, is to break the chain of infection. We want to get into that chain and we want to break it. We want to function within provincial and regional parameters, always, okay? Federal and provincial and local health authorities, their directives always supersede an organization such as CAFCN, okay? So the Association of New Brunswick Licensed Practical Nurses, they are going to be very pivotal in directing your practice. And the other thing with PPEs and working is that you must continue your competency, which means, okay, I learned this during my schooling, which was 5 years ago, and so that's all I've done. Well, okay, good that you learned it, but you know, life has changed, and we can see that in a very, very grand way now with COVID-19. So in New Brunswick, you are working within the public health phases and triggers algorithm. And I believe you are all in the yellow phase. And just recently, Campbellton was moved from orange to yellow, which was exciting for all the nurses working in there. So this is your go-to. Okay, this is the paper that you should have on your desks or in your binders or in your car, wherever you are working, so that you know exactly what's going on. This is an excellent, excellent resource, and I really have to give it to New Brunswick Public Health for creating this. It's very clear, it's very concise, very, very easy for us to look at. So we know in foot care, it's very, very difficult to maintain a 6-foot parameter around the people. So usually though, we can keep to about 4 or 5 feet easily because we're sitting at somebody's feet. Now, I know I've sat in front of a very short person and I was, you know, our knees were touching. So there are the odd situation where you're going to get closer than 6 feet. So we really need to remember what it is we're doing. So when you dress up for PPEs in a visit, okay, what you want to be sure and know is why you're wearing the PPE. If you have screened the person before you either made the appointment or when they came in my clinic, I'm sitting in my clinic room right now on my clinic chair. It is a work day for me, so I was happy to share this hour with you. What you need to do is remember, okay, when did I ask the questions? I do the occasional home visit, so I call them from my car. I call them into the house and I do all the COVID-19 screening questions. And if they answer negatively or in the negative to all the questions, then I'm okay to go into the home. Now, the last home visit I did, she had us set up on the deck. So it was a different situation altogether. I never did actually set foot in her home. So things were completely different. So if you've asked the COVID-19 questions and they have answered that they have not got any of the symptoms, they have not been in contact with any confirmed cases, they've not traveled outside the country in the last 2 weeks, okay, then you're going to go ahead and perform foot care. If they answer yes to any of those questions, if they've been tested and yes, they have COVID, and if they are symptomatic, you are not going to do foot care. Let me reinforce this. You are going to say, now we're going to reschedule you for a couple of months. And they'll say, and they'll cry, and they'll say, my feet hurt and my toenails hurt. And you're going to say, yes, I'm terribly sorry. Please wear slippers, file your toenails carefully if you can, and call me when you're tested clear. That is just it, okay? As a mobile nurse, as a foot care nurse in a clinic, you are not providing foot care to people with COVID-19 as much as they might need it. That is not our role. So wearing long sleeves, wearing short sleeves, wearing sleeve covers, wearing hair nets, wearing aprons, those are all the questions you have to ask yourself. For me, the two that never change is a mask and eye protection. I have been wearing eye protection since I started giving foot care. It's not even about COVID. It's about not getting projectile toenails in my eyes. And they have actually gone behind my glasses. So I wear full cover eye protection over my glasses. And now because I'm getting older, I take my glasses off and I do foot care without glasses because I can see up close, right? But I'm too cheap to buy bifocals. So eye protection for me is mandatory. I don't want fungusy nails. I don't want sharp toenails. I don't want a torn cornea. I don't want scratches on my eye. I don't want any of that because of toenail projectiles. The other thing is a mask. Now, if you choose to wear a fabric mask or a 3-ply ear loop or a medical grade or a respirator, that is up to you. I have personally chosen to wear a respirator when I do foot care for my clients because just even this morning, I had a client who was a very fragile asthmatic person who did honor me by wearing a mask herself, but she was having such trouble breathing that I said, you know what, it's okay. If you want to move your mask, I'm wearing a respirator. So I have protected both her and myself at the same time by wearing the N95 respirator. And to combat the air fatigue that I feel at the end of a day, wearing it 7 or 8 hours, once the person has left my clinic space, I put on a fabric mask because there are other people around me. My clinic is in a physiotherapy office as well as with an orthopedic surgeon. So there are people coming in. So I have tried to make it as contact-free as possible for my clients so that they can come in using the button on the door. They walk in all the way to my clinic room, they sit down. I walk further into hallway before they come in. We kind of keep our distance. I close the door and I sit down. So we're always spaced. There really is no reason for me to get that close. Now, I know that isn't always best scenario or best the way it always happens, especially if you're in the home. And I have some people that sit right over me watching me do their foot care. But right now, the things for you to remember is to think critically about what you're wearing when and why you're wearing it. When I do a home visit and I'm going into the home, I do get dressed in a disposable isolation gown with a hair cover. I leave my street shoes outside. I have clinic shoes that I wear in people's homes. Never, ever go into somebody's home without shoes on. Always keep, and this is another of my soapboxes, keep your car keys in one pocket, keep your phone in the other pocket, and always have shoes on your feet. Because if for ever any reason you have to run to protect yourself, you are not unarmed or unequipped, okay? Little sidebar. But I do that at the back door so that I don't get dressed up in the car, because we have to respect the privacy of our clients we're going to see as well. And the less the neighbors see, as far as I'm concerned, the better. It's none of their business. So I get dressed up outside their door, leave my shoes on the porch, put my clinic shoes on, go in the house, hand hygiene, all the rest. Hand hygiene it's not debatable. So if you don't hear me talk about it, it's because I'm assuming you're doing it, okay? And then before I leave at the door, I doff properly. There's an order to doffing. If you can't remember the order, I will sing you a song at some point later on. I've made up a song about it for when I taught at Brock. But for now, be very, very intentional about what you're wearing, when you're wearing it, okay? And why you're wearing it. Stay in New Brunswick. No, please, 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 and this is from the New Brunswick Association of LPNs, do not go into Quebec to provide foot care. And as tough as it can be for those of you who have clients in both provinces, the rules in Quebec are different than the rules in New Brunswick and further. Now, the maritime provinces, from what I heard on the news, have established a travel bubble, and that is so exciting. But that travel bubble does not include Quebec as well. Now, forgive me, because when I created these slides, Campbellton was on as a no travel zone. As I said before, that has been lifted, I understand. But if things change, you absolutely must be tuned into what your public health and what the association is telling you, okay? Protective eyewear is critical. Masks are imperative. And that's not even talking about COVID. That is talking about just protecting your own self, okay? Nobody needs to go to the emergency room and explain how they got somebody's fungusy toenail in their eye, scratching their cornea. Now they've got to do antifungal eye, blech, and really it's just gross. So the, okay, so this here, I don't know if you can see it. This is a fantastic document that the ANB LPN has sent out. Excellent resource. Don't forget that the links on some of these documents, they change all the time in the Canadian government, in the health sector. So do not come back on them for the links being broken. Just track it down yourself. You're adults, you're critical thinkers, you're professionals, you can do it. This document lays it out really, really well. And if you haven't, for some reason, accessed the document, it's called COVID-19 Foot Care Services. And I'm sure you will be able to find it on their website and or in your mailbox. People talk about wearing hair covers. Yes, you can do all of those things. And when I do a home visit, I also put a disposable apron over my isolation gown. And that is just, I've had toenails actually lodge themselves in that apron. They are flying so fast. And if I hold my hand over the toenail, it hurts when they hit my hand. So sometimes I just let them go and they just embed themselves in my apron. So that I take off as an extra layer. Those aprons are easily accessible. They do a lot of cover up work and they're very, very comfortable to wear. And you know what? We get hot. It's a part of the job. I haven't worn makeup since, oh, I know my son got married on Zoom on May the 2nd. And so I wore makeup for him that day. But I sat in the living room and he got married in his girlfriend's apartment. And honestly, nobody cares. I haven't worn makeup. It's sweat, you wash your face and you keep going. Okay, Kathy, are there any questions so far? I've just done a lot of talking.
We're just going to save all the questions till the end so you can get through your presentation.
Yeah. All right, let's motor on. Okay, so why does this keep happening? I clicked the button. Okay. I'm going to let you touch and I go down to the bottom. Okay, so the Canadian Association of Foot Care Nurses, many of you might know us, many of you might not, and that's totally fine. Joanne Graham is our board member, provincial advisor in New Brunswick, and we are very pleased to have Joanne. She's an amazing source of information. We are a not-for-profit organization for nurses and by nurses, and please, I know that you have some concerns about using the term nurse, and please recognize that when I say nurse in the presentation, I am referring to nursing professionals as well. We are dedicated to advancing the practice of foot care through collaboration, education, networking opportunities. And this year we were supposed to have our conference in Halifax and we had to cancel it. Like the rest of the world, we had to cancel things. We have a national annual conference next year. It's planned for Calgary. We're hoping to get back to the Maritime provinces very soon. But it's an amazing, amazing 2 to 3 days because we have established a whole workshop day, hands-on, practical, you name it, we do it. We look at providing, equipping our members and just continuing to build our association. We are working toward creating a foot care nurse certification that's recognized by regulatory bodies across Canada. And that is a long process that requires a lot of discussion. And that is, I believe, for the best, because then, you know, we cross all the I's, we dot the T's, and we make sure we talk to the key stakeholders. And that's what we are in the process of doing. Kathy, can you advance the slides? I'm going to stop touching the screen. I don't know what I'm doing here. Thank you. So our mission is to advance the practice of foot care through a collaborative and networking process for all individuals providing foot care. And we include every level of nurse, LPN, RPN in Ontario, RPN in BC, and RPN is a registered psychiatric nurse. We have RNs as well as nurse practitioners providing foot care across the country. Let me see if I can do it. Here we go. So our goals, we collaborate with healthcare professionals across Canada. So we work together with the Pedorthus Association. We have a very good relationship with the Canadian Medical Podiatric Association and the Ontario Medical Podiatric Association, as well as CNA, RNAO, Salpin, New Brunswick, and on and on and on it goes. We're developing educational opportunities, and because of the conference cancellation, we had to, we're looking at novel ways of bringing more education. We're looking at national guidelines and a certification process. We're promoting public awareness, and we're facilitating the development and publication of research-based articles. And right now we have 2 members who are, one just finished defending her doctoral thesis in Newfoundland, and one has yet to defend, and she is in Boston. And our Newfoundland advisor, Kathleen Stevens, is the one who just achieved her doctorate, and she is now embarked on hopefully another research study with foot care. So we are super stoked to support that. And you know, let me remind you that research is not the world of only RN and P. Somebody once told me, they said, I can't do research because I'm an RPN and I'm an LPN. I said, no, hold the bucket there. You can do research just as well as anybody else. So please never let that stop you. If you have a research idea and you just don't know where to go with it, let us know. We can see if maybe we can support you. Absolutely, find ways to help you. So we have an executive committee. We have advisors in each province and territory, almost. We're missing Nunavut and, Nunavut and Yukon. We have committees. We have almost 400 members across Canada. We have an industry partner program where we work together with industry across the country. Our big industry partners have been Neuberg Medical, Neuberg Skincare, CPC Healthcare, Pedicare in Vancouver or on the island, Quality Foot Care, and Footlogics. And we have our annual national conference, which is fan-freaking-tastic. Okay, here you will see where all our advisors are scattered throughout the country. I believe we have a new coming advisor in Nova Scotia, and so that's pretty cool. And we may have somebody coming in Labrador, but that remains to be seen. Okay. Oh, geez, I did it again. What the heck am I doing? Okay, I go to the little button and I press the button. Okay, so the National Competencies for Advanced Nursing Foot Care in Canada. The document looks like this. Okay, the print document. There is PDF access on our website in both English and French. And I want to thank Joanne Graham too for facilitating the translation into the French language. And I want to apologize to our French-speaking nurses because my French is terrible. I can work my way around a cereal box, but that's all. Or in Quebec, I can kind of kindly work my way around, but I wouldn't do it any sort of justice. So I do apologize. The objectives of the document were to develop consistency between practitioners, practice jurisdictions, and educational bodies, so that if somebody, so let's say I wanted to start Audrey's Saturday afternoon School of Nursing Foot Care, I could pick up the national competencies and I would know basically what a foot care nurse in Canada should know and where their competencies should be. We wanted to keep it such that a nurse in St. John's, Newfoundland, and a nurse in Victoria, BC, and then in Yellowknife and in Labrador, we were all on the same page as far as nursing foot care. Doesn't mean our scopes weren't different or that our associations had created different parameters that they wanted to see us function within. This is a broad spectrum approach to nursing foot care across Canada. And we wanted to build a foundation for the development of national certification process. Now, the national certification process, creating an exam and creating this process costs upwards of $2 million, which we do not have. So we are working with multiple agencies to try and see if we can create something. We don't need to reinvent the wheel. Let's just say we're working on it, okay? So the the practice document, the National Competency document, went through the definitions and created best practice, client-centered competency, and reflexive practice definitions, because that's something we all do. So best practices. So their recommendations, and these are based on the ones that the RNAO published in 2012, that basically we know best practice evolves. So when you talk to a foot nurse who started doing this 25 years ago, they were using alcohol to clean their tools. Sometimes they were using Black's files. They weren't using much of the high-tech equipment we're using today. And we know that that practice has evolved, and we as nurses and nursing professionals are required to evolve with it. Best practices are developed statements of recommended practice in a specific clinical or healthy work environment area, and based on evidence and designed to provide direction. And we know that we do our best to function within best practices. And I'm speaking to the choir, I know that. And you all know what client-centered is. It's an approach where we view the client as a whole person, and that's something that nurses are hollering about all the time, and in only the best way, because we don't look at the one part, we look at the sum of the parts. So especially nurses who are going into clients' homes, who see trip and fall hazards, or who see perhaps cognitive issues if the oven's been left on, or like this morning, my one client, he refuses to buy an extra walker, and he refuses to use his walker because the wheels get dirty. So he relies to walk on his daughter-in-law's shoulder, like he holds her shoulder. Honestly, I have visions of them falling down every time I see them. But if we weren't nurses like that, we would be looking at, you know, just the little pieces part. We look at the whole person as a whole, as the sum of their parts. Competency, we know it's our job to continue competency, the integrated knowledge, skills, abilities, and judgment required to practice advanced nursing foot care safely and ethically. And that's from the CRNBC in 2013. You know, we just have to set the bar here. Our standard is way up here. Reflexive practice is different than reflective practice. So reflective practice is when you look at your own practice and you say, okay, am I functioning within my competency? What are my ethics? Am I being accountable? Is my professional relationships and my therapeutic relationships, are they being nourished? Reflexive practice is different, where you acknowledge and you take account of the way you influence yourself on the care you provide. So it's looking at your professional practice, but in light of how you provide it with your clients. So the competency document development was a long and circuitous, well, it wasn't circuitous, it was dynamic process. So we started in 2015, and at the end of the day in 2017, we published it. And because it's 2021, somewhere around 2022, we're going to be looking at a review of the document, because even documents like this, they are not set in stone. It required a lot of input from stakeholders, from key stakeholders, from membership, from volunteer reviewers, to the consultants, to on and on and on it goes. And we're very pleased with the document, and we're so happy to have it available in French as well. So this is a beautiful model, and I love nursing theory. I know it's one of my favorite things. And if you guys ever get a chance, read Joyce Travelby. She was a nurse theorist who unfortunately passed away in the early 70s. She was an amazing, amazing nurse theorist. And her whole thing was hopelessness and finding meaning in hopelessness. And she talked about Viktor Frankl. And if you ever get a chance, read Viktor Frankl's book, Man's Search for Meaning. I could go on about this because it's my favorite absolute thing. But when we look at frameworks like this that you see on your screen, what those do is it kind of gives you a really good picture of how everything that you do affects your client. It affects you, but most importantly, it affects your client. So we took all of those things, because what we did was we wrote down absolutely everything a foot nurse does, and then we kind of started to group it into things and say, okay, well this belongs here, this belongs here, what does this belong with? And we came up with these 7 categories, okay, all influencing our clients. Knowledge-based practice, it's theory and application. So basically, this is the part where you sit down at your client's feet, They talk that they take their socks off, or you take their socks off, and you are presented with their feet or their foot, however. This is where you use your knowledge base. This is where you say, I'm not touching that, that's infected, or you may want to talk to your doctor about that, or when did that brown spot come up? Because you know about cancers, because you know about all those lower limb pathologies and physiologies. Advanced nursing foot care integrates a specialized body of knowledge of the lower limb and foot health into your daily practice. And if you follow in the competency document, when you look at knowledge-based theory and application, you will have like 21 statements under there, okay, broken down. We also, I skipped the part about assumptions. This is the assumptions page. We made a number of assumptions based on nurses across the country, because to call yourself a nurse or a nursing professional, you have to have good standing with your regulatory body. I mean, that doesn't change, so we weren't going to stipulate that. So there was a theory and an application piece, and the application piece is looking at mobility and physiology and pathophysiology and assessment and the nursing process, right? Referring, attending workshops, all those things. I think there's 35 numbers under application. The next one we chose was risk assessment and health promotion, because we are always looking at risk assessment. As part of my role, as Kathy said, with the Diabetic Foot Task Force, the big thing I keep trying to tell them is that foot nurses are literally sitting at the feet of Canadians. And while ulceration and ulcerative care is so terribly important, we are there before they ulcerate often. We are the ones who are saying, you know what, that heel feels really warm. I want you to get off that foot as much as possible this week. We are promoting the overall health, because we know that the mortality rates post lower limb non-traumatic amputation are so very high. So we use critical thinking and clinical judgment to identify risks and act to prevent negative health outcomes. And we're not just looking at their feet, like I said with my client this afternoon or this morning, who was leaning on his daughter-in-law. I'm like, no, you gotta use your walker. So we're educating clients and managing and averting risks to their lower limb health. And that's exactly what Kathleen Stevens's research is in Newfoundland. She was looking at putting, or she actually did put infrared thermometers from Home Hardware, I think it was, or Home Depot, in the hands of her clients. And she said, or the people who participated in the research, and she said, okay, I want you to measure the temperature of your feet regularly. And so what she was trying to do, and then if the temperature in the spots, any one of the spots increases or goes into a certain range, then she had them go into a self-management sort of offloading foot care protocol, looking to see if you can somehow mitigate ulcerations much more before you even see the skin turning pink, because we know that the skin changes temperature. So stuff like this is just brilliant. So you're looking at overall health promotions, very simple, $30 thermometer that you put in the hands of somebody that they just check twice a day. Oh, look, my heel. Like, we've all felt warm heels and cool toes, and you're like, something's going on here. So we also looked at quality practice, because our practice keeps changing. Our practice keeps evolving. And it, you know, even in the seven years I've been doing foot care, my practice has changed significantly, and in a number of ways, not just foot care at the foot of the person, but my instrument reprocessing from my clinic practices, all of those things, they keep changing and keep moving forward. That's why looking at documents like the CSA Z31418 document is so important. And by the way, it's free for read only. Because of the COVID, CSA made it available to everybody at read only, so you can't download it. But it's a $600 document for free, at least to read. Professional communication and relationship. You know, our relationships are professional with each other. They're professional with our clients. They're therapeutic with our clients. We're business people, most of us. A great number of us work for ourselves or work as foot nurses in other offices, in hospitals, in community centers. Some work long-term care, some work, you know, we work all over the place, and we have business relationships with those people as well. we're conscious of maintaining those boundaries. I've had clients try to friend me on Facebook, and I've had to say, you know what, it's so nice that you did that. What? I have a Facebook page for my business. I'd really love if you followed that, because that's where I'm going to put announcements. You draw the line between therapeutic and professional relationships. Now, I had one client who brought me a plant because we were talking about dahlias, and he says, oh, I'll bring you some. So you know what? I couldn't turn him away. That would have damaged that relationship. So now we talk about the flowers that I told him, where I put them in the garden, how they bloom, blah, blah, blah. So you have to really look at what your regulator says about gifts and all the rest of that, and maintaining and damaging relationships. It's very important. And your policies should reflect that as well. But we want to protect our clients from harm or exploitation. I've heard it again and again. Somebody says, honestly, a couple of weeks ago, I had somebody say, well, the lady who comes in to clean my house offered to clip my toenails for me for $20. My heart just sank and my stomach got all in knots. And I'm thinking, oh, okay, really? And then we had a talk about it. And, you know, I will not throw anybody under the bus. I think the housekeeper probably did it out of the love and generosity in her heart. Because people are genuinely kind most of the time. They are trying to help somebody. So we kind of have to weigh the difference between nefarious and good-hearted intentions that perhaps may not be in the client's best interest. However, at the end of the day, our clients are fully capable of making their decisions themselves most of the time, and we have to respect that. So it's tricky, but that's why we're nurses. That's what we do. So coordination and collaboration. We collaborate. We are conscious of the need to coordinate care for clients through collaborative networks and relationships, which promote lower limb and holistic health of each individual client. It's sometimes as simple as asking somebody, do you have pain in your calves when you walk? And they'll say, well, yeah, but it goes away when I sit down. Okay, well, that opens the conversation to, have you ever had a vascular assessment? Well, what's that? When they ask, what's that? They probably haven't had it. But it's just asking those questions that not everybody asks. And we're looking at, say, sending them back to their family doctor, or sending them to a podorthist for a gait assessment for offloading, or sending them to an orthotist or a podiatrist or a chiropodist for a partial avulsion or a full avulsion. You know, we are part of a network, and our job is to help navigate our person through that network, okay? Advocacy. We are advocates. You know what? We advocate the practice of nursing foot care. First of all, quality, best standards up here. Okay, that's what we're advocating. And to make nursing advanced nursing foot care services for all Canadians, which it is not. And we recognize that. And many nurses out there are working to promote that in a number of ways. I'm working together with a doctor who is coordinating local homeless shelter locations and coordinating regulated healthcare provider access to people in those areas who need it. So there are a lot of us who are doing this. We don't hear about it all the time. And you know what? I really want to thank people for doing it, because some of the heaviest cases we're going to see are in marginalized populations that don't have access to clean running water or basic hygiene facilities. And you know what, at the end of the day, they have feet too, and they deserve care. So if we can work together so that we don't have all these little islands providing care and using precious funding dollars, if we can really coordinate those funding dollars, we are really doing more work more efficiently. And we can use our influence, remembering that our influence is very strong. Nurses are one of the most trusted professions out there. So it's very, very important that when you're giving education advice or education, let's say onychomycosis treatment options, and you perhaps offer one particular treatment option, it is not in your best interest to offer only that one. You are to give opportunity to the client to pick what works best for them in their situation, okay? It should never be, Audrey told me I had to do this, unless it's quit smoking. That is the only thing I will ever tell anybody they have to do. Cut down or quit, Okay. Other than that, their choices are their own. And you know what? Sometimes they don't want to cut down or quit either, but I keep on it. Ethical practice. And you know, these are last, but they're not really least at all, because we didn't know how to stagger them, because they're all important. We're aware of ethical challenges in our practice. We're committed to protecting the public and providing services in an environment of safe, competent, evidence-informed clinical and business practices. That runs along with how you price your visits, how you choose to practice. And you know, most of us are very ethical, and most of us take it really to the outside degree, because who we are when nobody's looking, we understand is so important. And it's our job to keep aware of ethical dilemmas, of ethical boundaries, of stuff that may come up. You're kind of scratching your head. You know, I had it come up. I know it's a question we're waiting on the CNPS, which is the Canadian Nurses Protective Society, about this COVID public health tracing. Okay, so let's say somebody in my clinic comes to see me, and then within 10 days they call me and say, Audrey, I'm symptomatic. Okay, so they came to see me, they've said, I've gone and gotten tested, they come back positive. Okay, so am I beholden to hand over my day sheet and to public health? Or, you know, how much can public health ask of me? And we're waiting to hear that, because it's a legal and an ethical issue, because we don't share privacy information or private information about our clients. So there's always something. This does not end. So moving forward, we're going to review and revise these competency documents, you know, about every 5 years, because it is a long process. It takes some time and it takes some money. We're continuing to work forward toward national certification. Like I said, that has always been our goal. We did connect with CNA because they do have the certification exams. For the CNA to create an exam for us would require us to have 10,000 initial writers and 100 annual writers, which we cannot support just because of the fewer numbers of nurses working as foot care in Canada. But we'll keep working on it. And we'd like to develop standards and guidelines. And I know we did the process a little bit backward, but you know what? It was all well-intentioned, and we are going to move forward from where we are, because the documents are very quite good. I've done a lot of talking. I'm going to take a drink of water, and I'm going to open it up to some questions. I think we do have some time for some questions.
Yes, so thank you very much, Audrey. That was very informative, and I think we've got quite a few questions there, which is great. I'm sure we'll continue to have good discussion. I just wanted to share with the audience, we have 2 poll questions that Audrey wanted you to answer, so I'm going to launch those poll questions now.
Thank you.
So the first one should be on your screen. That's asked simply, are you currently a member of the Canadian Association of Foot Care Nurses? If you could just click yes or no to that. Let's give you a few moments to answer. It's still coming in. Okay, perfect. So I'm just going to share those results. So 14% of you are, and 86% are not.
Oh.
Okay, so our next poll question then is, are you interested in becoming a member of the Canadian Association of Foot Care Nurses? So yes or no. Perfect. So I will share those results as well. So 88% are interested in becoming members, and 12% are not.
No. Well, thank you everyone for that honest feedback. I really appreciate that. You know, and as an association, we're working hard to really bulk up our member benefits. Right now, we've got some really great ones that just came out. We've got infographics for client education that members can download. We have a brochure that members can download about what a foot care nurse does and what it is, with a little room to put your business sticker or your contact info on. And, you know, we're continuing to build that. So thank you all. I appreciate that very much.
All right, so I'm just going to stop our recording and then we'll have some Q&As. Just one
Sure.
sec.